in my subsequent slides. So this is a dictum. This was a statement given by H.J. Coolidge almost 90 years from now. What he said is publish or perish. What he meant by this is, if you are in an institute, or if you are in an organization, and if you want to grow, and if you don't publish, you will stay where you have begun with. You will stay there, and the people who publish their work will proceed ahead. They will take bigger responsibilities, they will take bigger packages, they will get bigger roles, and the one who doesn't.
Excuse me, sir, your voice is breaking.
1 minute. Is it okay now? Is it better?
Yes, Abhijeet, yes.
Yes, sir, yes, sir.
Yeah. Okay, so I was talking about the statement given by H.J. Coolidge in 1932, almost 90 years from now. What he said is, if you don't publish, you will not grow in your particular profession or in your particular specialty. You will stay there it is. And the people who are publishing their work, who are doing research, will grow ahead, will take bigger responsibilities, and will have better positions in their work. Now all of us have studied in different medical schools, in different states, in different part of the country. But then there are many things. I would say there are many important things and many important soft skills which medical college or medical school has not taught us. The list is very big, but this is what I think. They don't teach us leadership and team spirit. They don't teach us properly how to counsel patients and family. Empathy is something which we are not at all taught. Social responsibilities of a doctor are something which we are actually not taught. We have to learn by ourselves. Last but not the least, we are not taught about how to conduct research, how to audit our work, and how to write in medical journals. What we do in our post-graduation is we do our thesis, and all of us, sorry to say that, but we all know how we do our thesis. We copy, we paste, sometimes even our seniors, our colleagues, they also discourage us. Somebody wants to do it very sincerely, but then everybody says, don't you want to write your exam? Don't you want to pass your MD or DMD? So do something, print it, take your guide signature and submit it. So this is the type of research work that we are taught, unfortunately. Hopefully things will improve in the coming years. Let us see. So coming to the most important and pertinent question, why to publish? Well, everybody has their own reasons, but what I feel is, if you publish, you are recognized in your specialty. You are discoverable. By discoverable, I mean your work is seen by others and it is cited in other papers. Once you start publishing a few papers and your colleagues, your juniors, they know you that you are doing such things, you become a mentor for them, you become a role model, you become a guide for them. You create awareness, you disseminate knowledge with what you publish. You grow in your profession. If you are in a teaching institute or a corporate hospital or a medical college, you are entitled for promotion. Or in abroad, actually, if you are doing research work, you get research grants. You grow in the international arena. At the end of the day, even if you don't get any monetary benefits with publishing, what you get is satisfaction, and that satisfaction is profound. I mean, if you have not published yet, and if you do something, your name comes and somebody contacts you or somebody calls you and congratulates you, the satisfaction that you get is unbelievable. Another few more important things that we achieve with publishing is we get more involved in patient care. We explore a particular research question. It could be in any medical college, it could be in private practice. We get more involved in patient care. We started thinking about many other things like interaction of a particular drug, its subsequent consequences, etc. We have many times lot of dilemmas. We are taught something in our post-graduation, or we read something from here and there, but then there are certain unanswered questions. Many times, if you do your work systematically, you review the literature, you get answer to such dilemmas. and you end up exploring new horizons. Like, for example, some new medication enters the market, you do a few cases. Supposedly you are the first in your city, in your area to do that. You publish that, or you make a poster, or you make a letter to the editor, and then come out with that. You get recognition. Some regional anesthesia enthusiasts, they keep describing new blocks, rather newer approaches, newer techniques. That's what that's how new papers come out, new techniques come out. So coming to the benefits, say coming to the people who are in medical college and institutes, of course, yes, they get promotion, they get better salaries, better packages, they get more responsible positions. But for others, it's not that there are no benefits. You are indirectly contributing to literature. You get answers to a lot of questions which you were thinking for a long time. Even in private practice, it has been seen many, there are many, the list is very big. People in freelance practice or in group practice, they are called for in conferences and in webinars as faculties to deliver their experiences, to tell about their experiences, and even they are attached as visiting faculty to a lot of medical colleges. So coming to last but not the least, satisfaction. The satisfaction that you get, I mean, as I said in the beginning, there is, you cannot express that in words. Medical Council of India of late, in last few years, it has made mandatory to complete this course, not just for postgraduate students, but also for faculty. It is an online course. If you put it in Google, you will get the link for that. So there are certain phases of this which you have to complete. You have to achieve a certificate as a PG student, and to become a PG guide, you should have this certificate. So that way, indirectly, as I was telling, over few years, probably the things might improve, hopefully, and there will be a proper research methodology, exposure, or rather some core concepts will be imbibed in the teachers and the students as well. Indian Society of Anesthesia, wherever they conduct national conference, they have a workshop on research methodology, which actually gets get booked very early. There are very famous faculties which conduct this research methodology workshop. They are Divatiya sir, Bala Bhaskar sir, Dr. Rakesh Garg. So, I mean, anybody who is interested, who has now developed interest of late, can register for the next ISACON and attend this conference. Let me tell you, it is really very nice. So coming to the roadmap to publishing, suddenly you can't enter into publishing overnight. You think from tomorrow I'll start writing up. It's a little difficult. You have to be a little up to date in what's happening. You should be reading the journals, or following some online materials or blogs, or nowadays there are a lot of Facebook groups where a lot of latest knowledge is shared. So remaining up to date is very important, and having an eye on something different, something you should able to catch during your clinical practice. You find something unusual, try to explore that, put certain keywords in databases and find out something different has happened, and yes, you have something to write, you have something to publish. Once you find something to write, after that what you have to see is the journal and the category in which the article can go. As we all know, a single case can be submitted as a case report, but of late things have changed. A single case is no longer entered as a case report in many of the good quality journals. They are asking it as a letter to the editor. So you have to see the word count for that particular submission, write it accordingly, review the literature, cite them properly, and then submit your article. And once you are out with such article, don't forget to circulate it amongst your group, amongst your friends, amongst various social media, because that is how you will get comments. You will get comments from other, and that will actually help you in further refining your knowledge. It will make people give positive or negative things. With negative things, you will grow further. With positive things, your confidence level will boost. So coming to the types of journal, we always see many types. Open access journal. So what is open access? Open access simply means it is available for free. It doesn't mean open access doesn't mean it is free to publish. It is free to download. So open access means either the author pays or the society pays or the publisher pays. So if you see open access and you think, okay, let me submit it here, and you submit it, there are a lot of scary journals which next day they will send you a big invoice of some 20,000 or 30,000 rupees, and they will say, we will publish it in a day or two, you kindly pay the money. So knowing the journal before submission is very important. This open access icon you will see in many journals, but you have to be careful. These are the different types of open access. Gold open access and green open access is very common. Gold open access is where the author or the institute of the author, they pay for submission. So what happens is, in a gold open access, if the author or the organization pays, it is free for download for anyone. But in green open access, the publisher pays, or rather the author need not pay, but the article is available only for the subscribers of the journal. There is something called as embargo period. Embargo period is usually for a period of 1 year or 12 months. So for 12 months, officially, as per journal instructions, you are not supposed to share that article anywhere except your co-authors, or maybe in the institute repository you can put it. But you, because it costs the journal, what the journal says, because you have not paid and we have paid it, let only the subscribers get it. At the end of 1 year, it will be free for download. So when you submit, many journals, they ask you, how do you want to submit, gold or green? So it depends. If you are individuals or a group of people, it is always better to select green open access. But at the same time, the journal says there is no difference in the review process or the acceptance rate between gold and green open access. This is what they claim, but somehow I don't agree to that. I mean, wherever it is, if somebody is paying, of course they have an edge. This is what I feel. But if you go through the journal statistics, probably they will not depict that. But still, whatever said and done, it costs a lot of money. Better to always go for green open access. So there is something called as predatory journal. Predatory journals are nothing but they are ghost journals. They are run by small group of people sitting in small offices, having really colorful websites, and where they keep mailing you. They keep sending you mails. Once you have published an article, don't get surprised. You will get many mails saying that we have an option of have space for one article in any category. Kindly send your case report, case series, review article, whatever. We will publish it. These are the journals which are not indexed. These are the journals which are not peer reviewed. You will end up submitting to them, but the next day you will get a big heavy bill, and the article gets stuck with them. I mean, if you have submitted it somewhere, at the same time, even if they don't publish, it is not right probably to send it again to some other journal, because it is already stuck with them. So beware of predatory journals. Now, how to identify which is a predatory journal? There is something called as Beall's list. It is you can find it on Google. It has a search tab where you can put the name of any journal, and then find out whether it is a predatory journal. And if the name features, stay away from that. Block that journal from your inbox. Put it in spam, etc. So coming to the type of submissions, there are a lot of categories of submissions. It could be case report, it could be case series, it could be original articles, which are basically research articles. It could be prospective, it could be retrospective. Review articles are actually solicited by the editorial board, or if an author has written a review article, they are supposed to write to the editor prior to submission. Editorials are usually by the editorial board members. Letter to editors are basically these days in anesthesia journals. Single case reports or a case series of 2 or 3 cases are accepted in letter to editor category. And if they are more than 5 or maybe around 10, they are entertained in brief or clinical communication category. Viewpoint and opinion are something which are reserved for the expert. If you have something in mind, you can write to the editor, and then based on their discretion, they will allow you to submit in that particular category. So this is a diagram showing different type of clinical research categories. So once you have something in mind, for example, let me give an example. You gave some medication to a patient. For example, let me say ondansetron, and you found that the patient suddenly developed atrial fibrillation with fast ventricular rate. I mean, I am talking from one of our examples. So now you think this is something rare. So now whether can we write something on that? So what you are supposed to do? You are supposed to use keywords like atrial fibrillation, ondansetron, put it in databases. So what are the databases? Most common database which we use in our day-to-day practice is Google. But if you want to be more specific, I suggest put it in Google Scholar. The other databases are PubMed or PubMed Central, Scopus, and Web of Science. So these are the important databases where all the articles are later on they are submitted over there, and they get the indexing from these particular databases. If you have an idea, if you put the keyword and you think and you see that there are only few case reports similar to this, so you download all those articles, see what is similar. Is your case any different, or it is similar to what they have already published? You find anything different, start working on that. Write down the patient details, write down the baseline investigations, write down the patient history, how you manage that particular situation, whatever adverse event happened. Just keep a note on that, and then you decide, is there a new message with that? All this you will find only when you review the relevant literature. And once you have, I know this is somebody for a busy practitioner, it is a little cumbersome. It is not easy, especially somebody who is in a group practice or working in several hospitals. It is not very easy. But then in the beginning, I said, it comes with interest. If you have an interest to do, if you want to explore something new, if you want something different than what you are doing on a daily basis, this is what I can suggest. It is, let me tell you, it will be a little frustrating in the beginning, but once you develop this interest, it is really exciting, and it is really an experience that you will cherish for the rest of your life. One thing that as anesthesiologist, we should always do is seeking help. It could be, the help could be in OT, the help could be in your private practice, the help could be for writing down a paper. You can ask your colleagues. Most of the times, what many people say, my colleagues, they are not helpful, they are not doing anything, they want me only to do. This is a common thing. I experience the same. But then you have to identify, you have to look for people in other departments. If not in anesthesia, look for someone in surgical department. I know even this is a little difficult, but then where there is a will, there is a way. If you still don't find anybody, don't forget people who have taught you in medical colleges, or your seniors who might be in some institute as a faculty. Don't hesitate to contact them. I am sure everybody will be helpful. And once you identify somebody who is there always to help you or guide you, make him or her your mentor, and then start and develop your passion for publishing from there. Journal selection is something which plays a very important role. I usually select, when somebody asks me, tell them to go for a specialty journal. For example, if the article is about perioperative care, then if it is what I meant to say is, if it is related to obstetrics, initially try to look for an obstetric anesthesia journal. If not, then there are a lot of anesthesia journals, but preferably try to avoid a multi-specialty journal. Why I'm saying this is because the article, it gets lost over there, because there are broad specialties, there are super specialties, then sometimes there are non-clinical branches and all. So it becomes a little difficult. So you have to, the choice of journal is very important. Once you decide the journal, open the website of the journal and read the scope of the journal, read what the journal expects the author to send. And then based on that, look for the word count and see which particular category your article fits into. Once you have decided that, see the acceptance rate. Acceptance rate, most of the journal, they give their acceptance rate. Some journals have as low as 5%. Indian Journal of Anesthesia in the last 2 years, it is around 50, in the range of 15 to 20%. There are journals like Saudi Journal of Anesthesia, which is 25%, and Anesthesia SSS Researchers, which is very high, up to 65 to 70%. Another thing which many people they suggest is impact factor. Somehow I am not a very big fan of impact factor, because for me impact factor is like the TRPs of the television serials or the ratings of nowadays OTT movies and all. I mean, it is all, I believe it is all fabricated, because there are many journals which insist the authors to put to cite the references from that particular journal where they are submitting. So what they get is they get a denominator where there are many references, many articles cited from that particular journal. So many journals they build up impact factor, but there are really big journal for, like for example Lancet, New England Journal of Medicine, where the citation is inevitable because they do so big work that they invariably get cited. They need not tell their authors to use their particular article. So I will not suggest to look for the impact factor, but then if somebody is very keen, yes, they can go for that. Another important thing to know is whether the journal is paid or free journal. As I said, open access doesn't mean that you don't pay. Open access means it is free for download. So read the instructions carefully. And many people they ask me, can we submit 2 or 3 journals at a time wherever it gets accepted? At least otherwise we will save time. Otherwise it will take 6 months for review. Then we submit it to another thing. But let me tell you, I suggest submit 1 journal at a time, because if God forbids, if your article fortunately or rather unfortunately it gets accepted in 2 journals, it is a very difficult situation, and definitely the editors, the journal will find out, and then this will really harm your reputation. So please submit 1 journal at a time always. So these are certain articles somebody wants to read about the impact factor. I don't like this terminology of impact factor. So I always find articles and read about where they mention all negative things about impact factor. So it is definitely, as I said, it is widely used, but it is misused and it is abused by the journals basically to get more articles for publication. Language of the article. We all see, if everybody have done their thesis, we all know how big our thesis is. It is 70 pages, 100 pages, 120 pages. Many of my friends have sent their students' thesis to me, suggesting that we need to publish this. Can you go through it? Can you imagine how many words that particular thesis has? One of the theses had 25,000 words. Now you tell me how to bring 25,000 to 3,000 or 2,500. So this is how this is how difficult it is, and how we write it over there. The tense is very important. Once a thesis, if you write a protocol, it has to be in future tense. If you write a research article, it has to be in past tense, because you have already finished and now you are writing. So the grammar is very important. For all of us, people from India, English is not our native language. It could be either first or second language during our schools, but then that should not stop us from writing in English. There is a free site called as Grammarly, which will tell you once you write in the Word document, you check it in Grammarly, and it will really correct your grammatical mistakes in your particular manuscript. Avoid long sentences, avoid claims and all in your article. Don't make essay type narrations. I mean, it doesn't look good in a scientific article. The author instructions are actually very important, and every journal, they expect the authors to read the instructions in detail, because the instruction tells you how to break your manuscript. For example, introduction, methods and materials, discussions. Then you can have some journals, they don't allow you subheadings. Some journals, they allow subheadings. They specifically write in the instructions not to write with bullets and dots and arrows and all. But as many enthusiasts, they don't go through the instructions properly and they submit. So if a reviewer or an editor sees this, they get annoyed, because it is clearly mentioned in the website, and still you are not following them. This irritates them. So what happens is your paper comes back to you. It really wastes your time also and the time of the editor and reviewer. So you have to now read the instructions properly, do it again, and of course now such kind of submission, of course there will be a delay from the journal reviewers. Another important thing is citing the references. Every journal has their own style. They mention it in the instructions how to cite. Some journals, they ask you to put it in brackets along the line, in the same line. Some journal, they ask you to put it in superscript, in bracket or without bracket. Many times what we do is we send it to some journal, we read the instructions. The other journal, now it has been rejected. Now we are sending it to other journal. We did not go through the instructions properly, we send it as it is. So, but that particular journal required it in some another way, and you have not done that. So, knowing the style of referencing is very important. The word count is let me tell you, is very important, especially for a free journal, because they are not charging you. They expect you to follow their instructions and to stick to the word count as strictly as possible. So, again, the challenge is to restrict yourself to the word count. At the same time, make your point, make your discussion conclusion in that particular word count. So accept this as a challenge. I know it is a little difficult at times. When we want to say something from the heart, we just keep on writing, but then that's not how we do it in a scientific paper. Case reports are actually very important. Many of us, we encounter something or the other in our clinical practice. Sometimes it could be rare, it could be an anesthetic challenge because of comorbidities. It could be a learning point. And many times I have seen in people in many group, in many of my friends also, they use some different technique, something which is either not described or less described. So these are the situations where you can develop a case report and write it as per journal instruction. But however, let me tell you, case reports are usually considered low priority in many of the journals. Acceptance rate for case reports is actually very low in major journals. To address this problem, there are many dedicated journals which publish case reports only. For example, Anesthesia Analgesia Practice. They accept case reports only up to 1500 words, up to 10 references and one figure and one table. Similarly, Anesthesia reports from UK, they also accept clinical cases only. And Journal of Anesthesia and Critical Care case reports. Again, this is an exclusively case report journal. So as I was telling you, if you have a new technique, a new approach, that is where it should click you and you should start writing. For example, let me give you a recent example from Ganga Hospital, Coimbatore, a paper by Dr. Tuhin and Bala Venkat sir, where they have described the novel technique for supine popliteal fossa block. It is a wonderful paper, and they have supported it with very good images. Few years back, 4 to 5 years back, there was, even still it is very much discussed, opioid sparing or opioid-free anesthesia. So in the institute where I used to work earlier, we tried this for mastectomy patients. We used opioid-free mastectomy. We did a series of 5 cases, which was very successful. Outcome was very good, and we published a case series on this. 4 years back, again, sublingual buprenorphine tablets were available in India, and we started using initially for the cancer patients for chronic pain, and then we saw the literature, and it was actually approved for postoperative pain also. So we did a case series of 10 cases, and we published it in Indian Journal of Anesthesia. And it became a practice actually in our institute. So we thought we will do a randomized controlled trial involving total 100 patients in 2 groups, and even that has got accepted, and it will very soon get published. So this is how, you see something new, a new drug in the market or a new formulation, try to use it, see the results, and there you are, you have something to write about. So I have had the honor of being associated with Dr. Sandeep Diwan in his work. So this is how we started. He has this, I had seen in few of his presentations that he had described contrast studies related to transmuscular quadratus lumborum block. So it was again developed into a case report, and it was also published in Indian Journal of Anesthesia subsequently. The problem is when we decide to write, we just go a little overboard. The issues that are most commonly encountered is we end up writing a lot and we cross the word count, and we sometimes at some point of time we lose the focus. The article doesn't seem to be to the point. This is because, as I said in the beginning, we are essentially not trained during our training, and so there is a learning curve to this. So this can happen only when you are frequently reading journals, scientific journals. Nowadays, everything is available online, so whenever you have spare time, at the end, what you have to also see that every journal has their own instructions. So whatever it is, the word count, the message, the style, you have to focus on that and draft and make changes accordingly. The discussion part is supposedly the most important, because that is what will review the available literature if there is any, and also make your point. And if you have images, never forget to take permission of any X-ray, even if the patient's identity is not revealed. For example, it is not any part of the patient body, but if it is the ECG of the patient, or if it is the monitor, don't forget to, because nowadays all of the journals are asking whether you have taken permission to share the details, or you have taken permission from the patient or next to kin to publish this as a case report. Okay, so these are the ethical issues which are very important. So you have anything in mind, whether you publish or not publish, you describe that in your meetings in your local society also. Take a consent from the patient. So this is a standard case report form. If you put it in case report patient consent form, you put it in Google, everything will come. You can download it, write patient's name in comments, just write why you want it, take take a signature and all, and keep it with you. It might you might need it anytime. Suddenly you think, okay, let me submit it as a poster somewhere in one of the anesthesia conference. So at that time also you might actually need it. Now, letter to editor. I mean, many of us they think it is a very inferior quality of submission, but let me tell you, it's not like that. Letter to editor are actually articles which are comments on published articles. But of late, journals like Indian Journal of Anesthesia, Journal of Anesthesiology, Clinical Pharmacology, Saudi Journal of Anesthesia, and many journals, if you have a single case report or a case series of 2 or 3 cases, they are asking you to submit in letter to editor. The word count is variable from 500 to 1000 words. The references could be 5 to 8 or 10. And most importantly, it is peer reviewed. Why I am emphasizing that letter to editor can also turn out to be a landmark paper is by looking at the paper by Dr. Rafael Blanco, which he published in Anesthesia, which is a journal from the UK. All of you might have heard about the PEX block. So the PEX block, the initial description was published in Anesthesia. It was in 2011. And as you can see over here, there are 469 citations till date. Till today, there are 469 citations to this letter to the editor. So what I mean to say is, whatever the category, any article can turn out to be an important article at the end of the day. So this is one of our letter to editor which we had published in Indian Journal of Critical Care Medicine. What we did is people working in critical care, they know the mnemonic fast hugs BID, which is for any of the patients admitted in the ICU. It is a mnemonic basically. We just modified the medical ICU mnemonic to a patient who undergoes a major surgery, so that we don't miss anything while examining the patient. So it gives me immense pleasure to tell you that it is one of the most downloadable articles published in IJCCM till date. Out of the 10 most downloaded paper, this is one of the letters actually. It is not an original article, it is not a review article, it is a letter to the editor. So this is a cycle of publication basically. You write, you draft it, you submit it, and then it goes to peer review. Peer review, many times I have seen, I know 2 or 3 of my very good friends whose paper they submitted to good journals, and there were a lot of negative comments on that, and that negative comments had such an impact that after that they decided we will not write anymore. I mean, this is something, this is very childish, I will say. I mean, to be very frank, there is an ethics for the peer reviewer. They should not be criticizing. I mean, that it should be a gentleman's criticism, in the sense it should not be hurtful. But sometimes certain words we are a little upset, so we get upset with that. We talk about racism and all these things. Oh, probably he knows from where I am from India, probably we are not white skin, that's why. But there is nothing like that. But it should be taken positively. See what the comments are. Sometimes there are 10 to 15 comments for the article, but if you read each and every comment, everything, most of the comments are answerable. What they it is expected is make the changes in the manuscript as per the suggestions of the peer reviewer in a format, specifically in a table, and necessary changes you make it in the article, highlight it, and then resubmit it. So if you address each and every point, and at places where you are not able to justify or you are not able to provide an explanation, you can mention that also. Even that is not taken as negative. So if you answer each and everything properly, there is still a fair amount of chance that your article might get accepted. But then at times you have to take it with a pinch of salt, and that's how the process goes actually. So coming to the deficiency cited in manuscript, this is an old paper actually, but it is even relevant today also. As you can see, in most of the articles, the methodology deficiency was seen in almost 75% of the articles. And after that, the writing style, the literature review was the aspect which was found deficient. Everybody must have heard about what is plagiarism. Plagiarism is nothing but it is copying and pasting without attribution and without citation or without giving credit. Okay, so if you have taken a particular sentence, or you are using a particular, if you are using a particular comment conclusion from anyone, so you have to cite that. You cannot put it right as it is. There is something called as paraphrase. Paraphrase is nothing but copy paste only, but you have changed the quotation marks, or you have found some synonyms for the author's language while keeping the same meaning. It is as good as plagiarism, but a little lesser severe type of plagiarism. There are a lot of free tools available in the market to identify plagiarism. It is small SEO tools is something which the Indian Journal of Anesthesia and JOCP they recommend. They ask you to put your entire manuscript in that and check for plagiarism. It gives in percentage. Basically, at any given time, you can put 1,000 words only, and it gives you a plagiarism report also. And it shows you what sentence, what part of the article is plagiarized, and then you can make necessary changes and then do the plagiarism again. Another is plagiarism X, plagiarism checker X, but here you can only do check for 500 words at a time. Authenticate is a costly software which is actually used by the bigger journals like Brazilian Journal of Anesthesia, Regional Anesthesia, Pain Medicine, Anesthesiology, and also I think probably they buy it, publisher buys it, and every article goes through this plagiarism check, which I believe could be more authentic than the other two. So this is what is given in the journal instructions, how to write references. So see, as you can see, consider this as an example. These are the name of the authors. While writing references, what they say is if there are more than 6 authors, write the name of 6 authors followed by et al. But some journals say if there are more than 6, write first 3 authors only and then write et al. So read it properly. So this is, after that comes the title of the article, then comes the name of the journal, then the year, and this is the volume number. The one in bracket is issue number, and after that is the location in the particular issue, basically the page number to be more specific. Many journals, they ask you to give the DOI. DOI is nothing but digital object identifier, which is like specific for a particular article. So you have to read it, and if it is necessary, you have to put that also in the bibliography. These are the most common journals basically, and let me tell you, all of this journal are these are all open access journal, and these are all free open access, in the sense the authors need not pay a penny for submitting this and for publishing this. Indian Journal of Anesthesia, JOACP, Saudi Journal of Anesthesia, and IGCCM. I am mistaken here. Anesthesia Essays and Researches is a journal from Saudi Arabia, which is again published by Walter Closer and Medno. This is a paid journal. So this has an acceptance rate of almost 60 to 70%. It is PubMed indexed. It is an index journal, but it is paid. So these are a few recent journals which have come in India. IJRA is the official journal of or Academy of Regional Anesthesia India. Journal of Oncoanesthesiology and Perioperative Medicine is the official journal of SOPSI, or Society of Oncoanesthesiology and Perioperative Care. And Indian Journal of Anesthesia is again a journal. All of these are open access, free to submit, free to publish, and all of them are accepting, or rather they are asking authors to submit their articles for review. So coming to International Committee of Medical Journal Editors. So this is a particular document which defines authorship. Authorship is very important in the sense, if you have people involved in a particular study or in a particular paper who are eligible for authorship. I see many times from the anesthesiologist, there will be two, there will be a surgeon, there will be an assistant surgeon who will have actually no role in that particular thing. Now, the surgeon will say, oh, I did the case, so you could write, or you did in my hospital. But if you go by ICJME definition, that does not qualify for authorship. You can acknowledge them, you can write an acknowledgement. Their name will not come in the indexing. But in that way, I don't prefer to put names of people who are not directly involved in authorship, because that is unethical, and we need not encourage such stuff. So these are the particular areas or particular responsibilities which can make anybody, or which the person can claim to be an author: for conceptualization of a particular idea, for data curation, for analysis of data. Even somebody who helps in funding of a particular thing can also claim for authorship. The one who devises methodology, resources, software management, supervision, validation, writing the original draft, and reviewing. So these are essentially the areas. If somebody has done this, they can be given authorship. But just because it is somebody's hospital, or somebody is the director of the hospital, or somebody is the shareholder of the hospital, or somebody owns the pharmacy of the hospital, they don't claim authorship ethically. So coming to writing, that is what the entire topic is all about. I will not deny that it is a tough task and it is impossible alone. But finding two similar people with similar mentality doing same stuff is a little difficult. Why it is tough is, and why usually people are alone, is because it is time consuming. It needs motivation. You will be motivated probably after hearing about somebody who has shared his work in Facebook or LinkedIn or somewhere. Now I should do. But then that motivation should be sustained. And unless you are not in a teaching institute, there are actually no monetary gains. So that itself is enough to demotivate you. So what are the solutions to this? Inculcate interest. Look out for colleagues with similar interest or passion. Try to maintain a logbook. This is what I tell many of my friends who are doing in many areas, especially in Nagpur and all, who do high risk cases. I always tell them, maintain a logbook, keep an Excel sheet. And whenever you get an opportunity, you cross 10 cases, 20 cases, analyze it and make a write-up. Now in the era of social media, we can have really good follow-ups. We can Once the patient is discharged, you can call them, you can ask them, you can inquire about quality of recovery, or if any adverse effect, if any. There are a lot of courses actually, online courses and all, but somehow I will not suggest that because it doesn't really help you much. That way, if you have somebody known to you, some mentor, and if you take their guidance, that will take you a long way instead of these courses. You can start presenting at local meets and then presenting posters at local conferences and then national conferences. Even in ISACON, there is a private practitioners forum where the private practitioners are encouraged to present their work. So the problem is it is not it is basically with the writers basically because they find themselves alone. They don't get any help from the colleague. Nobody enjoys writing. If you see, if you ask somebody, it has happened sometimes. I have asked some of my colleagues to write. So I mean, it will be at times. I mean, sorry to say that, but at times it will be very haphazard, very casually written, and sometimes it even doesn't sound scientific also. So they don't enjoy writing unless there are some gains, there are remunerations. Then definitely you will find something different. So many times the writer or rather the author, they just write, but they don't read it at the end to ensure that it is a good reading material. There are issues with surgical colleagues who are, if we want to do some new procedure, new technique, they usually don't support you, especially if you have gone to their hospital and all, or if they are the owners of the hospital. So these are the technical difficulties which you will encounter if you want to embark on a journey to start publishing. So what are the solutions? I would say online courses are not the best way to deal with it, but yes, you can attend workshops. As I said, research methodology workshop. Find a mentor. Keep reading peer-reviewed index journals. Try to maintain a log. Keep follow-up. I mean, that will inculcate some kind of interest. And try to look for something new, unusual. I am sure many of us keep encountering certain new, unusual things and all, but the interest is very short-lived because we suddenly, after some time, we jump to the next case, and the interest is gone. The patient is discharged, and then a new message to the literature or to the fraternity is lost in this way. So now that another year is over, the new year has started. So if it's still not late in anybody, whatever, in my opinion, there is no age to start research or to start publishing. It can be started immediately after your post graduation or at any part of your career. So I thank all of you for patient listening, and I am ready for questions if any.
Very nice presentation, Abhijit sir. And
Thank you, Sachin. Can I stop sharing or what, Sachin?
yes. You can stop sharing.
Thank
If
you, Dr.
possible, you
Abhijeet
can
sir, for
on your video, Abhijit sir.
Pardon?
If you can on your video,
Okay, sure.
so we can see you after a long
Oh,
time.
oh. Okay. Okay, there it is.
You yes.
Yeah, tell me, Sachin.
Yes. Jayant, any questions from your side?
I was thanking him for such a vast and such a knowledgeable presentation. Many things which he has covered in that. I don't think anyone will have some questions about that because he has covered nearly everything about that. Still, if someone having any questions, I am requesting the people to ask him freely. Please go forward if anyone having.
Any question in question box? No, nothing. Okay.
No, nothing.
Uh,
That's what I'm saying. He has covered all the
no,
basic points about that.
actually, Sachin, such topics are actually quite boring to hear also after certain time. Initially, I mean, I
Sir,
mean, this.
I might tell you that this is the highest attendance we have got in such we have presented at least 7 cases till now, but this is the highest attendance. 38 people have joined now. This is the highest one.
More than it's in peak time, almost 48 or 50 something was there, but it is not a part of that. We are not related to TRP and such. How much member? That's not a part
Okay.
of us. This is a
Yes,
continuation.
Sachin.
Actually, we are keeping this for platinum jubilee of our ISA national, and our is silver jubilee this year. So my motto is to keep every one case meet in every week. So it is like that we are celebrating this event for
Okay.
this year.
Sir, 2 people have raised hands. Dr. Sachin Pawar has raised hand. He
Sure.
wants to ask
Manmohan
a
sir,
question.
also
Please.
Manmohan sir also, I think.
Yes,
Hi,
please.
Abhijeet.
ओए मनमोहन बोलो
Manmohan from
मनमोहन from England. I know. बोलो.
hello. What a wonderful talk. I'm so impressed. I don't know what to say. You know, it gave me so much knowledge. Because
मनमोहन,
I'm
you
not
are.
a big fan of research, but I think I will change my practice. I would probably go into research now because you said that it can happen at any stage of your career. Yeah. So very, very impressive and very wonderful talk. So what I want to ask is, you know, for a publication of any case reports or any such case series, is there a time limit? Like, you know, if we have done it like a couple of years ago, can we
Yeah.
still send it for
There is no time limit, Manmohan. But the thing is, if it is something very rare, and in last few years it has not been published by anybody else, probably then you have lost the window of opportunity. But yes, but if it is so rare that it has not been in any of the databases or any of the good journals have not published it, you still have a chance, Manmohan. I mean, there is nothing like late or anything. There could be delay in if a research article, probably if you try to publish after 4 years of it's being done, because a lot of things change in 4 years. Then there are new papers that come, the bibliography changes, the evidence changes. But regarding case report and series, yes, you can publish anytime, Manmohan. Anytime.
Okay. Thank you. I'm so proud that you are our
Man,
colleague in during our Nair time. So
Manmohan,
thank you so much.
you were my mentor when I was in Nair. You helped me in my thesis. You are my mentor. Okay.
Okay, thank you, boss. Thank you.
Yeah.
It was great.
Thank you.
Great to catch up. Yeah.
Hi,
Yes, Dr. Sachin Pawar.
Pawar, no? Yes.
Yes.
Yellow
You
Dr.
can
Sachin.
go ahead.
Hello, sir. Good evening, sir.
Yeah, good evening, Dr. Sachin.
Sir, can you some enlighten some current guidelines for PG teacher? Because recently, 2020, I think they have changed some guidelines. So can you throw on lights regarding PG teacher for medical college, PG teacher?
See, Dr. Sachin, I mean, last 10 or 12 years, I have been working in corporate hospitals and also basically I was a DNB guide for some time, but that was almost quite some time back. So probably you
Okay.
will, I mean, I am not, and in last 1.5 years, I am not even in India. So probably I am not the right person to answer this. But
Okay.
having said that, the rules, there are a lot of dynamic changes in the eligibility of the PG teachers. I mean, it keeps updating every 1 or 2 years. So maybe I would suggest better you go to the website and check. I'm sorry, but I won't be able to give a proper answer to this because I am not aware of this.
Okay, sir. No problem. Okay, sir. Thank you. Thank you.
I think Manmohan sir again raised question. No. Manvi Verma has raised hand. Please ask, madam.
Hello, sir. Good evening. Thank you for the very informative talk. It was really very enlightening.
Good evening. Good evening.
Sir, how to bounce back from rejection once the article is rejected? How to find the motivation?
Last year in PRAC, that is Pune Regional Anesthesia course, I had a presentation. Dr. Diwan has asked me to speak on this, how to deal with rejection. If you want, I will share the presentation with you. But the thing is, first of all, the reason for rejection is what you should analyze it critically. In the sense, was it something which the journal has already published? Was there a clear-cut message in your article, or was your paper in the scope of the journal, basically? So there are these are certain important things. Now the next question is, what I would ask is, which was the journal which rejected your paper? That is the thing. Nowadays, many journals are rejecting if you don't have a prospective registration, if it is an original article with clinical trials, regulatory of India, or any of the prospective databases. If you don't have a registry, so they are not accepting. Retrospective studies, you can as such you cannot register. And thirdly, if it's an original article and at any given point the editor or the reviewer feels that there are certain ethical issues which has not been addressed, that is one of the reasons for rejection. So each
Okay,
and
sir.
every comment of the reviewer which gave rejection, many times the journal, what they say is, we don't have enough space. There have been similar articles already published. There is no new message in the article. So mostly these are the common reasons of rejection. What the thing is, when we write something, we do research, anything, it could be case report, case series, we always feel it is it has been done very nicely, and it deserves a publication, but the publisher or the editor thinks otherwise. So last few years of that particular journal, if you go through, if you put the keywords, and if any similar work has been published, that is one of the most common reasons, if it is not ethical or if it is not anything else like plagiarism or something.
Okay, sir. Thank you.
Yeah.
I think Ujjwal sir has raised his hand.
Yeah.
Please, sir. Please, sir.
So please unmute your first.
Now,
Yeah.
can you hear me now?
Yes, you can see you also.
Good. Okay, so I wanted to ask you one question.
Yes.
For how long, say for example, you were talking about consent forms.
Yeah.
You need to have consent forms for whatever publication or publishing the photo or something
Yes.
of that sort, data, etc.
Yeah.
For how long are you supposed to preserve the consent forms?
They say it should be preserved for 10 years.
10 years, I mean, after the publication has been accepted?
Yeah, after the publication. Actually, the thing is, it is not about the consent form, actually. It is about the metadata, the master chart that we say. The details of master chart has to be preserved for at least 10 years. Regarding case report and case series, usually once it is published, there is no meaning. You can actually just scan it and keep it somewhere. The original part can actually be discarded also. Once it is published for a case report series, it has no direct implication. But yes, for an original article, the metadata has to be at least kept it somewhere in some Dropbox or some Google Drive for at least 10 years.
Okay, fine. So minimum 10 years we are supposed to preserve whatever we can.
Yeah.
Okay.
Whatever.
Thank you. Thank you.
Yeah.
And I think Gurpreet is curious on the other side that you have not recognized him as a mentor and you have recognized only Manu as a mentor.
What I said was true.
Other half of Manu.
Okay.
No, just kidding. Just kidding.
Okay. Thank you.
I first of all welcome to all our Nair seniors. They came and they give their valuable time from their busy schedules. Avinash Bhosle sir, I think our MSCISA secretary, Dr. Avinash Bhosle sir, was present. I think he's. Hello, Avinash sir. Even our president, Dr. Katikar madam, was also present. I think he left.
Can you see me?
Yes, ma'am. Please, ma'am, please. Yes.
Enjoyed listening to Abhijeet Nair.
Thank you,
I
madam.
joined.
Good evening.
I joined little late. Good evening. Good evening. I joined little late, but since I just want to add one thing regarding the things you mentioned regarding plagiarism.
Yes,
Even
ma'am.
our Indian Journal of Anesthesia,
Yeah.
it checks plagiarism through I authenticate. So
Yeah, but they ask the authors to do it
no,
through
no,
small
no,
SEO,
no.
but later
Yes,
on
yes,
they check it through Authenticate. Correct.
yeah. The
Yes.
editors can check it through I
Yeah,
authenticate.
because they have an access, and for
And yeah, yeah, because it is a paid
it is a paid
plagiarism
thing.
tool.
Yes, yes, of course.
And you find a difference between whatever is the articles which has been plagiarized, the check through the those tools, and when you check through the I authenticate check,
Of
there is a
course, yes.
vast difference. The similarity of content with I authenticate is definitely different than what you get with the other free
Of course, madam.
plagiarism tools.
For
So
something
that
which
is
you
the difference.
pay, you get more anyways.
Yeah, 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 yeah.
Yeah.
It's nice meeting you. I have
Thank you, ma'am.
heard so much about you, and heartiest congratulations for getting the Best Reviewers Award this time at ISACON Ahmedabad.
Thank you,
Could
ma'am.
not meet you
Thank you.
personally. Yeah.
Maybe sometimes soon, madam. We'll meet.
Yeah, and it was nice to know that you are also from Nagpur.
Yes, madam. I am a GMC Nagpur alumni 1995 batch.
Oh, 1995. So even I belong to Nagpur GMC,
Oh,
86 batch.
nice
Nice
meeting you.
meeting you.
Same here.
Thanks. Thanks, Sachin.
Thank you, Abhijeet.
Thank you. Good
Wonderful
work.
job, Abhijeet, as well as Sachin.
Thank you, madam. Thank you. From madam point of view, madam, can you give? I will give one work for you. Please,
Yes.
you should go ahead for vote of thanks from our side to Abhijit.
Okay. Okay. First, I would like to congratulate ICE and Nanded for this wonderful activity. And I came to know that they are conducting it in every week as a Platinum Jubilee celebration. Heartiest congratulations, Dr. Kotkar as well as Dr. Sachin, for such wonderful academic events. This is the second time I had logged in for such wonderful academic events, and it is not like that you are just inviting people from Maharashtra, you are inviting people from outside Maharashtra or outside India also, and that is really encouraging. And like the way I was surprised when I came to know that, like when we started organizing Maharashtra State Chapter ISA activities twice a month, people said how frequently you are doing clinical activities. But then seeing the ISA Nanded activities, I'm highly impressed. Please continue this good work. So heartiest congratulations, Team ISA Nanded. Dr. Abhijit Nair, it was such a nice gesture that you do not, now you are not staying in India, and still you gave so much of time to ISA Nanded, Maharashtra State Chapter ISA. We are really thankful to you for your nice gesture. Your slides are too good. I had taken so many photographs of your slides just now when you were presenting.
Thank you.
Unfortunately, I joined late, so I request you to share your slides with Sachin so that we will be able to
Madam,
get
it
all
will
the.
be on YouTube, madam. 1 to 2 days,
Okay.
madam. No problem. I will share that link.
Yeah, even I will share the presentation also
Yes,
if
yes.
Sachin
Yeah.
wants. I will
I will
share with
give
him,
number
madam.
2, madam.
Thank you for your kind words. Uh, it's an honor for me basically to speak for. I mean, Sachin is a good friend, so when he said, I mean, there is no way. I mean, although I'm staying far, but it's a good way. I mean, it's a way of getting associated with all the all
Thank you.
our friends and all. So
Thank you.
It,
Thank
thank
you.
you.
And
it
many
seems
more.
that yeah,
I
it
think,
seems that Sachin has many good friends all over globe.
yeah.
Yeah.
Many good anesthesiologist friends.
Due to Nair, madam, because our peoples are almost all over the world.
Yeah, yeah, yeah.
And
True.
maybe, and Abhijit will come again and again on this platform because it almost 48 weeks we are conducting every week. So I will give some task in next 2-3 weeks, and he will agree
Abhijit,
with that.
I would like you to speak on clinical trial registry because that the private practitioner finds difficult.
Yeah,
So
it
if you,
is a bit
yeah, it
difficult for
yeah, private
anybody actually.
practicing anesthesia. No, but
Yes,
for
Yeah.
yes,
private practicing
Yes.
anesthesiologists,
Yes.
it becomes really difficult.
yes, yes.
And second thing, I would also like to tell you that it is also not easy for the private practicing anesthesiologist to get an ethical committee approval. It is
Yes.
a
Yes.
really difficult task because
Yes.
if they are not attached to any medical colleges, they do not get ethical committee approval so easily, because then they have to consult the ethical committee in the medical college that is present in their city. They have to apply for that, and they have to wait for a long time till they get invitation
Yes,
from the
yes, madam.
ethical committee. So for private practitioners to present their original work in the form of research article is really a difficult
Yes, yes,
task.
madam.
So that is the biggest hurdle, in fact.
I agree with you. Yes, yes. And even, madam, for that matter, clinical trials registry, once you are uploading anything for approval, even that needs an ethical committee
Yes,
letter.
yes, yes.
So without that,
Absolutely right.
yeah, without
Unless
that,
you have ethical committee clearance, you just
you cannot.
cannot register
Yes.
your work on a clinical trial registry.
Yes, absolutely. And actually, it takes so much of time if you are doing it for the first time, because I have done on several occasions. So it is a bit time consuming, and but the good thing is, if there is any lacuna in that, it will come back to you immediately the next day till you
Yeah,
have
yeah, yeah.
cleared all the
Yeah.
lacunae. I mean, they will
Yes,
not keep you waiting. And once everything is cleared, you get the approval with the
yeah.
CTRI number. Yeah,
Yes, yes,
that's
yeah, and as you mentioned correctly, for everyone to know that unless the your original work is CTRI registered, it
yes.
will not be accepted in
Yeah,
any index
yeah.
journal.
Even now
Nowadays,
in IJ
they are not.
also,
Yes, yes, yes.
let me tell you,
No.
madam, on that lines, journals like Korean Journal of Anesthesia and Korean Journal of Pain, for case report and case series also, they want a prospective registry. I mean,
Okay.
that is, I
Okay.
mean, so that is actually a bit of setback for people from other places where we don't register case report and case series
Yeah.
for
Yeah.
in clinical trials registry, but then they will send it back otherwise.
Yeah. Yeah. So that is another important issue. So I think this ethical committee approval, clinical trial registration are the two important
Yes.
parts as far as the private practicing anesthesiologist is concerned.
Yeah, true.
So they have to cross so many hurdles to present a
So many
critical
hurdles.
paper.
Yes, yes, madam.
Yeah.
Because my one article was, I'm planning to publish, but there is no ethical committee in Nanded.
Yeah.
So I asked to medical college. They said you IMA people are doing some ethical committee forming. So I asked also them also. They said it will take 2 to 3 years to form a committee. Then
Yes, yes, that
my
is the biggest lacune for all of us, because
Uh,
we have to go consult for Nanded. Then you can go and talk with ISA Aurangabad, not ISA Aurangabad, the medical colleges in
yes,
Aurangabad, and then you have to wait for a
yes, yes.
long
So
time
many,
till they invite you
yes,
yeah.
for
madam.
the meeting. Then they will raise you so many queries. Then you have to
Yes.
satisfy those queries, and then again go back. Again, they will have to wait for an invitation.
It's easy to
So
participate in a institutional. It will be easy to publish a paper. Manvi Verma has risen.
Yes,
Please,
sir.
madam. Please.
Sir, I'm not from anesthesiology, and I find all this academic program of yours very informative and helpful. So, is there a way I can follow?
Sachin, this is for you. Is it?
Madam, on which platform you heard this meet?
No, actually, my brother is an anesthesiologist, so he shared that it would be useful. So,
Okay, okay. So no problem, madam. We are sharing this meet in only ISA uh, groups. So from your friend, your brother, you can
okay.
get it.
Okay. Thank you.
Yes.
Thank you.
Thank you, madam. Thank you, Abhijit.
thank
Thank you,
you,
Sachin. Thank you, madam.
Yes,
thank
yes.
you. Nice meeting you.
Yeah,
Yes.
same here.
I think Pooja Vaishnav raised hand. Oh no. Abhijit sir, are you hearing?
Yeah, yes, yes, Sachin, I am here.
Pooja Vaishnav has raised hand. Please, Pooja madam.
Hello.
Hi, Abhijeet sir.
Good evening,
Hello.
Pooja. Tell me, how are you?
Hi, sir. I'm Pooja. I
Oh,
have worked
okay.
with you when you
I
were
know,
at Hyderabad.
I know, I know, I know. Tell me.
Sir, yeah, it's nice. The entire presentation was very superbly put and extremely well worded. Yeah, I just wanted to know, sir, if once we get a reply from the journal saying that you are not getting anything new to the this thing, if these are the words used, does
Haha.
that mean that it should be like not to be pursued ahead? Like
Not in that journal. It clearly means that
okay.
not in that journal. But if you think you have something to say, you have a new message, so you need to
Hmm.
select some other journal. And first of all, before submission, you should first see whether the journal has published similar stuff. Put the keywords, put in the search
Okay.
box, and if it is not there, then you go ahead. Because as I
Okay.
told you, if it is a case report or case series journals, they are a bit I mean not a bit reluctant to take it unless it's
Hmm.
something, some syndrome or something really unusual. One very important thing is people are a bit wary, or rather not very much into publishing negative data. For example, negative in the sense some adverse event and all,
Yeah, yeah.
they don't report, thinking that they will
Hmm.
think the reader will think they don't know stuff, they did not do things properly. But then even these are important things. So I would suggest, if any journal has said there is no new message, look for a new journal. There are, if you put in Google GFMER, Geneva Foundation of Medical Education and Research, and write anesthesia in front, there will be some 35-40 journals, list of journals with the link to the website that will come. So you can start selecting and seeing where, and start seeing where you can send.
So
So
can
we
you
have lot of
just can you say that again? Geneva Foundation of?
GFMER, space anesthesia.
Oh, okay. Okay. All right, sir. Okay. It will basically give us a list of
All the
this thing,
anesthesia, perioperative care,
anesthesia journal.
pain, all journals. So not all of them are like indexed and non-predatory. So you have to go through